Hello, good morning. Today our lecture acute coronary syndrome. Your teacher Begum Talapqızı. How are you? Prepare your notes and pencil. Today we are writing what is mean acute coronary syndrome, which disease have in this syndrome, and also reasons, symptoms and risks. Okay, and our heart anatomy. Introduction. Acute coronary syndrome is a term used to describe a number of conditions associated with a sudden reduced blood flow to the heart. One of the concomitant diseases of acute coronary syndrome is myocardial infarction, heart attack, when cell disease leads to damage or destruction of heart tissue. Reduced blood flow alters heart function and indicates a high risk of heart attack. Attention, if you have symptoms, consult a doctor, do not self-medicate. Acute coronary syndrome often causes severe chest pain or discomfort. In this case, urgent medical care, rapid diagnosis and proper care are necessary. Treatment goals include improving blood flow, treating complications, and preventing future problems. Signs and symptoms of acute coronary syndrome, which usually begin suddenly, include the following: chest pain, angina pectoris, or discomfort, often described as pain, pressure, or burning. Pain radiating from the chest to the shoulders, arms, upper abdomen, back, neck, or jaw. Nausea or vomiting, and dyspepsia. And we are continuing. Signs and symptoms of acute coronary syndrome, which usually begin sudden, includes the following. And shortness of breath, also the symptom acute coronary syndrome. Sudden heavy sweating, and also lightness, dizziness, or fainting. And because maybe with this patient starting cardiac shock or unconsciousness, and also tired. Attention, while chest pain or discomfort are the most common symptoms associated with acute coronary syndrome, the signs can vary significantly depending on your age, gender, and other related factors. Most often, acute coronary syndrome manifests itself without chest pain or discomfort. This is common for women, the elderly, and people with diabetes disease. And if your patient have chronic disease, and also maybe starting this. Okay, reasons and the look. This is first, when the plaque ruptures, a blood clot forms. Second, this clot prevents blood flow to the heart muscles. And the third, when the oxygen supply to the cells is too low, the heart muscle cells can die. Cell death, which leads to damage to muscle tissue, is a heart attack, myocardial infarction. Okay, reasons. Even when there is no cells, these insufficient oxygen supply still provokes improper and inefficient must to work. This dysfunction can be temporary or permanent. When acute coronary syndrome does not lead to cell death, it is called unstable angina. And this picture we can look mechanism. Risk factors for acute coronary syndrome include an older age, over 45 for men and over 55 for women, high blood pressure, high cholesterol in the blood, smoking cigarettes, lack of physical activity. If your patient every time sitting, eating, or sleeping, not have activity, and also this is risk because this patient starting overweight. And also unhealthy diet, if your patient eating unhealthy food, and high blood pressure, diabetes disease. And if your patient have diabetes disease, and also this is very more important because high sugar damage in all our organs, vessels, and after starting and more complications. And family history of the chest pain